Good afternoon, everyone, and welcome to the latest in the Kids Matter series of webinars. This one is titled Suicide Prevention in Primary Schools. And we're very pleased that you've joined us today and the panel that I'll be introducing shortly. We've got over 260 people who have joined us so far. We're expecting a few more as well. So thank you very much for being part of this, and also if you're watching it later and the podcast, welcome to you as well. We can see people from all around the place. I can see Alice Springs, Brisbane, Sunshine Coast, Melbourne, of course, where I am. So people are joining us from all around Australia, which is one of the features, I guess, of the webinars that we hold, and really enjoy that. This webinar is run by Kids Matter, and hopefully people are familiar with Kids Matter. You'll get to hear a little bit more about it tonight. So welcome to our various audiences, Kids Matter schools and early childhood services. Some of those staff will be joining us today, as well as health and community professionals as well, who will be joining us. I'd like to begin with an acknowledgement of the traditional custodians of the land and pay my respects to elders past, present and future, as they hold memories, traditions, culture and hopes of Aboriginal and Torres Strait Islander Australians. I think in a topic like suicide prevention, it's important for us to be very mindful of the impact of the past on Aboriginal and Torres Strait Islander Australians and the increased risk of suicide for those populations. So being mindful of that is very, very important. This is our panel for this evening. So I'm from Kids Matter at the Australian Psychological Society, and I'm the National Project Manager here. And you can see there that we have a great array of people who are going to be presenting on the topic and the case study that hopefully you've had a chance to read from different perspectives. So one of the ways that Kids Matter works is health and education people coming together. So you can see there the people on the panel are representing schools and education and health from different perspectives. And so that's one of the great strengths of the panel. So welcome to the panel, and thank you very much for joining us, and we'll introduce you as we go through as well. Before I do that, though, some ground rules, and this is an important topic, but it can also be quite a difficult topic. So it's important that we are mindful of that, I think, as we do go through, and just thinking about treating this as a face-to-face activity in some ways, even though it's a virtual sort of space. Thinking about it as a professional education forum, so professional learning opportunity, but being very mindful of taking care of yourselves. And we're very aware that for many of you, you'll be on your own with this, so you're not actually part of in the room with us. So we really want you to be very mindful of that, and what you might need to do is take care of yourself, particularly with a topic like this. You can use the general chat box to post comments and questions for panellists. We already have lots of questions that came through when you registered, and we'll be doing our best to answer lots of those, and hopefully we'll get through a lot of those. If you need to get some technical assistance, you can see already there are phone numbers coming up to help you with that, but also the technical chat box is a box to put any of those questions that you have. So if you're having some difficulties with sound or other things, put a note in there, and people from Redback will be able to support you with that. But just be mindful that anything that you do put in the chat boxes, everyone else can see. So just being mindful of that. The general chat often gets quite busy, and people comment and share lots of information. So if you find that's a bit distracting, because it can be that you're listening to the panellists and you're trying to read things and make sense of it all. If you find that the general chat's getting a bit busy for you, you can hide that. So just click the small down arrow at the top of the chat box, and that can hide that for you, so you can focus on what's going on the screen. We'll have a survey at the end so that you give us a chance to get some feedback, which is always useful for us. And also down the bottom right-hand corner, there's a little folder that you can see. And people often ask us, can we get the slides? Where are the slides? So they're already in there, and you will get an email the next week or so that'll give you the recording and resources as well. So in that folder, there's also a resource list. So things we can't cover tonight, or things that people might refer to, hopefully you'll find the links in there, and we can add to that as well when it comes out by email. Hopefully you've read this already, our learning outcomes for tonight, and this is this very big topic. It's based around the case study, that's a made-up case study, we made it up, about Ms Lavis and Willop State School. So we're really wanting to look at the importance of suicide prevention and how that links with the mental health promotion, prevention, early intervention framework in primary school settings. But we didn't want to just sit with that, because we thought one of the things that sometimes happens in primary schools is students expressing suicidal thoughts or behaviours, or behaving in ways that people can be quite concerned about. So we thought it was important to acknowledge that as well, and to really extend knowledge around working together with families and the important role of families with the lives of primary school children, the role of school staff and health and community professionals in the area of suicide prevention. And I guess the message is really around suicide prevention being part of the work that you're doing all the time, even though you might not think about it. But I think a very hopeful message that what we're trying to do in a lot of the work that we're doing around mental health promotion and prevention of difficulties could be classified as suicide prevention. And I think it's useful to know that Kids Matter was originally funded years ago. When it began 10 years ago, it was actually funded through suicide prevention funding from the Commonwealth Government. So that gives you a bit of an idea about the direction we're going in, and the research telling us that that is the work that we do from that whole school, whole community setting. I do want to begin with a little bit of information. I know some of the questions coming through we're asking some questions about where's suicide and self-harm, where do they sit, are they the same, different? So we thought it was probably useful to do a bit of this kind of clarification from the start. What is it that we're actually talking about? And as I said, we will be looking at that promotion, whole school sort of approach, as well as that more early intervention when someone is concerned about suicide, or when a suicide has occurred in a community and may impact at a school level. And we know that does happen, unfortunately, that is something that does happen. So being aware, being ready for that is going to be really helpful. So you can see there a definition, you can see where we've got those definitions from if you're interested in finding out a bit more. So suicide, we're talking about the intentional taking of one's own life, and it's quite difficult often to know when a suicide isn't a suicide. So it's investigated by coroner and looking at the evidence for that. But sometimes it can be quite unclear. An attempted suicide is described as a deliberate harming of oneself where the intention was to die but didn't necessarily result in death. Suicide thoughts or ideation you might hear about is a term that's often used. Our thoughts and may include a plan to suicide, to take one's life, and they may be connected and be the cause of attempting a suicide attempt. But many people have those thoughts and don't necessarily act on it. And I think that's a really important message, that people might have those thoughts, but it doesn't mean that it automatically leads to an attempt of suicide, particularly if we can actually address it in some way and actually hear what's going on. And we'll be talking about that this evening. In terms of suicide in children, I think people are perhaps interested in what do we know about that, and we don't know a lot. The statistics don't usually, anywhere around the world, don't usually kick in under 10, really. So we don't know, and there's also lots of debate about that in terms of children's understanding of impact of suicide and understandings of death. So there's lots of debate in the field about that, and there's really not enough research and stats to tell us that. But we know it's rare, and we're very grateful about that. But we do know that schools are facing experiences of children talking about suicide, and certainly communities facing experiences of suicide in the community, which is what I've said there. Self-harm is something that can be connected to suicide, but is not necessarily the same as suicide. And Kids Matter does have a resource, and we've got that in our resource list. We have a video and some information about self-harm. So we're talking about deliberately inflicting physical harm on the body in different ways. And it might be part of a suicide attempt, but it might be something quite different. So they're not necessarily connected. And so that resource will help clarify that and help schools work out and health community professionals work out what to do if that's happening. So tonight we'll focus much more on suicide risk itself. Prevention initiatives focus on reducing risk factors for mental health and enhancing the protective factors. And if you're familiar with Kids Matter, you'll know that that's one of our frameworks, the risk and protective factors. So it fits very nicely with that, and that's the way that the Hunter Institute, who do a lot of this work, will be framing it. And we see primary schools as a key time to focus on prevention, suicide prevention, and promoting mental health and helping children learn how to cope with emotions, learning how to adapt to stress, learning how to seek help if they need to. And that's very much messages of Kids Matter, and it will be the message tonight as well. So that was a very, very lengthy introduction, and hopefully that's clarified some things for you and a very quick overview, but hopefully it'll just position what we're going to be talking about next. So I would like to now move on to the panel. I'm sure you've had enough of me talking, so I'd like to introduce our first panellist, and this is Jo Munn, and Jo is Assistant Principal of Hastings Primary School in Victoria, which is Kids Matter School, as you'll see from the very beautiful banner behind. So Jo, would you like to present to us now?
Hello everyone. Yes, this is quite a real situation for me, and it's becoming more prevalent in my school community and work environment. So as the assistant principal, I'm quite often the first port of call for these sort of incidents that happen in the community. So I can relate quite closely to our case study. So one of the first things that I would be conscious of is the juggling act that I have to have as the assistant principal. So my first thing would be to actually garner the facts of the situation. So we'd be looking at what do we know. So we know that we've got a young graduate teacher who's in her first position in a rural school community, teaching a year 5, and obviously has that interest in mental health and wellbeing by just her observations of students in her class. She tells us that she has a student, Ronnie, who's in her class. He's one of 4 siblings. His father's away for a large amount of time, and he's starting to display signs of withdrawing in the classroom, daydreaming, and so on. We know that the environment is one of a small population, close-knit, and they've experienced the recent suicide of a local police officer who also has children attending the school. From my perspective, the things I don't know is I don't know whether Ronnie's family were connected to the police officer's family. I don't know whether Ronnie's a good friend of one of the police officer's children. As far as the current welfare program in the school, or I question whether there is one, just with the response of the principal to the teacher's concerns about Ronnie. Another thing we don't know at this stage is the family situation, other than mother is not able to be in contact with the school, and she's having a neighbour pick up her children to take them to school. So that's what we know. I have to juggle knowing that information, the things I don't know, and giving an immediate response to 2 key people, as in the class teacher and to Ronnie. So here we go. So the first thing I would do is return to the teacher and congratulate the teacher and acknowledge her on the observations that she has made of the change in Ronnie's demeanour. Very important. She's brought it to the attention of the principal, and she needs to be congratulated for that. The fact that she's sought Ronnie's previous class teacher's opinion on the change in what she sees as Ronnie's behaviour from the start of the year is excellent. The fact that she's also provided a safe environment to open discussion with Ronnie about what may be bothering him. She's made immediate contact with the parent, or attempted to make contact with the parent, and also that she's elevated her concerns to the principal. So as a young graduate teacher, she's on the ball, in my opinion, and we need to be sensitive to her needs as well as to Ronnie's. So we would be going about putting in place some protective factors immediately. For Ronnie, what we want is the situation to return to normal as soon as possible, so that we're his baseline behaviour, pre-morbid, becomes present. So the behaviour that was being displayed, as mentioned by his previous teacher, is where we would like to go with Ronnie. We'd be looking at what's happening with Ronnie in the playground, in the classroom. Is he struggling with his work, and has he disengaged with his out-of-school activities, i.e. sport? And where possible, we're trying to find out what's happening in the home environment for Ronnie through just some simple questioning of Ronnie, really, and Ronnie's mates. As I said, the immediate support to him so that we can get him back to some positive thinking, and to know, for Ronnie to know that he has the immediate attention of his class teacher should he need that. And also just continuing to provide that safe environment where the teacher would discuss with Ronnie, when best would you like to have a chat with me? It might be first thing in the morning, playtime before they go out, or maybe come out in the playground and have a chat with me at lunchtime. Around the teacher again is to affirm her concerns, because I think she has every right to be concerned. Where I'd go with that, I'd possibly try and match her up with a supportive colleague who could act as a mentor to offer her further advice on a debrief for that session she may be having with Ronnie. I'd be looking at what's been in place as far as an induction program in the school about the wellbeing processes and referral pathways, especially about what hasn't that teacher been told about the school's response to the suicide. Normally in a school situation there is a critical incident response, and the teacher may not be privy to what happened in the past if it was before she arrived at the school. So we would be hoping that someone could brief her on the fact that maybe counsellors were brought into the school, and there were those sort of supports put in place for staff, students and extended families of the school. In Ronnie's situation with the family, I'd be trying really desperately to make contact and start to build some sort of relationship with the mother in particular. Obviously, being at home, 4 children, the partner or husband being away for long periods of time. Is she has in the past, she had good communication with the school, and has that dropped off? We don't know that, and if it has dropped off, well, the school has to try its best to build that communication again, whether it be by phone. Schools now have access to social media through, at our school in particular, we use Dojo and Edmodo, where teachers can make that immediate contact, and a parent just has to be home to respond on the computer, and you can begin the discussions that way. That way we can find out what is actually happening in the home. Are there stresses in the home around father not being present, and is that contributing to Ronnie's thought processes about, well, Dad's not here, don't know what's happening with Dad, and we saw what happened with the police officer. You don't know whether he's drawing that connection. So, in a school, as far as the structure that you would hope a school would have to wrap around those supports for the teacher and the student and the family, we'd be looking at this sort of structure. So hopefully at a school, as small as that one may be, there would still be a gathering of like-minded colleagues who would have a bent around student wellbeing, so formulating a team, and from there the practice would be to discuss a wellbeing plan for that student. Then we would see if the student needed further support, the possible referral and assessment through our SSO service, which might involve contacting a psychologist or a social worker. From there, it could end up being a regular support group meeting, which would include the parent, SSO, professional class teacher, and perhaps the assistant principal, as in the case that we have at our school. If there's a need, possibly to then do a referral to a private psychologist, attending a GP mental health care plan, and then the psychologist can begin that practice of counselling with the student. The ideal practice is if you can actually have a private psychologist working within your school, so you've got that consultation process between the student, the class teacher, other members of the student wellbeing team at the school, so that suggestions and strategies are swapping across on a constant basis. The counselling and, of course, the shared strategies that would come out of that. If the situation does escalate, there would then be a pathway into an ELMS referral or in life mental health services, and through that possible links to other community health providers. Now, the way forward for Willop State School. I think it does need to initiate a student wellbeing team if they don't have it. There is obviously a need to have an explicit social and emotional learning skills program where everyone in the school is following a particular program that addresses the needs of building the skills of resilience, persistence, getting along, all those life skills that we know students need to improve their mental wellbeing. The fact that the school would promote and destigmatise mental health issues, and there would be a pathway for early intervention strategies, so staff would be trained in looking for early symptoms of students who may be struggling, and then knowing a way forward to provide the supports and the backups for them to actually promote better wellbeing for the students. And linking into any health and community agencies that may be available in the area, so that if the family are needing the support, the school is obviously an ideal way to build the relationship and draw that link to those community professionals. And that's it from me.
Wow, thank you, Jo. There's a lot of information in there, and you can see the work involved at a school level. And I guess if you're not sort of thinking about or aware of what goes on behind the scenes in a school and what the deputy principals get up to when something like this happens, you might be surprised to see the amount of work and the amount of thinking and conceptual analysis that goes into this, and thinking about the various levels and what's happening at the community, what's happening within the school, what's happening for this particular student, and then engaging with the family. And of course that often takes quite a bit of time. I can see in terms of the chat, there's a bit of confusion when you talk about a student support, school support officer, student support officer, service officer. People in different places around the country are asking lots of questions about that. So we're talking about Victoria here. Jo, can you just talk about that process in terms of the SSO? I'll go with SSO, it's a bit easier.
Yes.
And when you might, but also, you know, private psychologists for other people as well, because SSO means different things in different states and territories.
Okay. Right. Well, right here, it means student support service officer, and it's usually a team delivery. So within the network or region, there will be a number of psychologists, social workers, and speech therapists. As a school, we can access the service of one of those personnel through an online application, and then the SSO leader assigns a worker to the school. The worker usually is familiar with the school and has a connection, and arrives at the school. Parent permission form is signed, and the discussion is around the needs of that student. So once those needs are discussed, then it's decided, well, does it require cognitive assessment? Should we be just looking at some counselling sessions? Should there be work with the class teacher? There are many ways that they can deliver their service. It can be ongoing for a number of sessions, or it can be a one-off session. And they're people who are very important when you have your student wellbeing team meetings, provide further support and advice on where to with really difficult students and families.
Yep. Okay, great. Thanks, Jo. So that's the situation in Victoria, and you can see there from some of the comments that it's the training or the title is used quite differently in different places, and there'll be various ways that this operates. I guess the main thing when we are talking about a student like Ronnie in the case study, and I realised I didn't do the summary of the case studies, but hopefully you've read it and you've got a sense of it now. So Ronnie is in the classroom. There's been a death by suicide of a person in the community. So that's an element that's in the community. But in this classroom, there's a teacher who's concerned about Ronnie, who's expressed has been saying some things around some suicidal thoughts, and so that's what triggered this whole kind of intervention, I guess, from the deputy principal. So thinking about what are our referral pathways, what does it mean for us in our school? And if you're a teacher at a school, that's part of your work. It's a really important part of what you do in terms of how do we know when we need to seek some support, so teachers being aware of that, and then someone who can actually do a proper risk assessment. So someone who has the training, like a psychologist or social worker or other people who have done some kind of risk assessment training that can actually confidently do that assessment of risk, support the school, and then from there work with the school and the family, of course, in a primary school setting. That's really important. So hopefully that's clarified some of those things. Before we move on to Tegan, I also just want to acknowledge that there are some people in the chat who are sharing some of their own experiences of their own mental health challenges and that of their children. So just wanting to acknowledge that, and when we're in a professional space like this, of course, we all have our own experiences in terms of mental health and family experiences of mental health. So just wanting to be mindful of that, and that is why you can see we've been including Lifeline's phone number, and we'll keep talking about this idea around self-care and looking after yourselves, because we do know that suicide and concerns around suicide and concerns around mental health difficulties touches us all in various ways. And for some people, that's some of the reasons why they're doing the work they're doing. So that's coming through as well quite strongly. All right, let's move on to Tegan. And Tegan Cotterill is the Acting Program Manager with Hunter Institute of Mental Health. So Tegan, we'll move on to you now. Thank you.
Thanks, Lyn. So I think Joe there mentioned quite a lot of different strategies, particularly in terms of responding to the young boy Ronnie and some of the concerns that were raised there. So I guess what my focus is going to be, which is in line with the focus of the Hunter Institute's work, is around, what can schools do to prevent suicide? And if we're talking about primary schools, I guess the best way to prevent suicide is actually if a school can adopt a whole-of-school approach to promoting students' resilience and wellbeing. So there are a number of education practices that support the mental health and wellbeing of children, and these are actually represented in the child framework, which you can see in the infographic in the slide here, which is being created by the responsibility team at the Hunter Institute, who provide pre-service resources for early childhood educators and teachers around how educators can support children's wellbeing. And a quick overview of the child framework is around some of the strategies that schools and teachers can implement. So it's about creating a safe and supportive environment for optimal wellbeing and development, helping children to learn social and emotional skills and to manage their own behaviour, identifying the children and families who may be in need of additional support, linking families in with support and information services, particularly around mental health and wellbeing, and also developing a broader organisation and community strategies that support wellbeing. And I think these practices are particularly important if a child is experiencing difficulties and those that might be associated with their family environment, their physical, social, emotional needs, which may not be being met at home. And that's some of the factors that might be in play for Ronnie in the case study. So I'm just going to go a little bit into detail about the child framework. Now, I guess remember that, I've only got a few minutes to talk today, so I'm not going to go into super amounts of detail about this, but there's a lot more information available on our website, which is Responsibility, and the links to some of the most relevant resources to this particular presentation are provided in the resources for this webinar. So if we're looking at the C in the child framework, it's around creating the safe and supportive environments for optimal wellbeing and development. So basically what do we mean by this? It's when teachers and schools can help provide opportunities for kids to build secure attachments, to establish and maintain respectful and trusting relationships, and to also develop a sense of belonging. Helping children to feel safe by excluding fear and making sure that they have a trusted adult available, and also respecting all children as individuals and acknowledging their diversity, culture, temperament and other preferences are good things to consider if we want to think about how we create a safe and supportive environment. Some of the ways we can do that is looking at games and other interactive learning in the classroom to help students build connection and resilience. Also thinking about activities or a particular session where students and teachers are actively encouraged to develop positive relationships. This is really important because it helps to improve students' sense of connection with their teachers and peers, and also helps to promote that help-seeking behaviour. And I guess as well, and I'll talk a little bit about this later, it's about those school policies, a culture and staff practices that helps create that supportive school environment, and that includes the modelling of positive relationships. So if we move on to the H now, it's around helping children to learn social emotional skills and manage their own behaviour. So how we can do this, it's about providing experiences and activities that offer opportunities for children to understand the emotions of themselves as well as others, to help develop empathy and respond to others' feelings appropriately, and to also learn effective social interaction with peers and pro-social skills. So examples of activities that you can try with students around that are thinking about mindfulness exercises, as well as meditation, and also providing safe spaces for quiet time. So providing opportunities for students to learn about wellbeing and other personal issues, also having clear policies in place that help deal with any problematic behaviour, and also enforcing those consistently. And also thinking about how you reward students' positive behaviour and recognising student achievement. So it's all these things that help to reinforce the positive behaviours that we're looking for, while also helping to manage and model what the consequences might be for less desirable behaviour. So moving on to the I, it's around identifying the children and families who may be in need of additional support. Now, this is something that Jo already mentioned, and I know that Marie is going to talk about a little bit more as well. But basically, what we know in a school setting, teachers are in a perfect position and are very skilled in observing children and can help pick up the signs of difficulties. And that might be around children who aren't meeting their developmental milestones, but also when there's challenging behaviour occurring, particularly when it's in multiple settings and persisting over time. So some of the key things to consider when you're thinking about who might be in need of additional support, it's around the severity of the issues occurring, if they're persisting over time, if there's an impact on functioning, so is it, reduce the child's functioning, or is it actually resulting in a delay in the child achieving the developmental milestones? And also, are these difficulties a significant change in behaviour for that child? So we know that intervention early on in children's lives, if kids are experiencing difficulties, can help prevent and also improve emotional and behavioural difficulties. However, before that can occur, children and their families who are experiencing those difficulties need to be appropriately identified. But fortunately, teachers are actually really well positioned to do that in their daily practices, and because they can actually observe the children and also compare how the children are performing in a range of situations and tasks. So if we're thinking about if we go on to the L slide as well, that's around linking families with support and information services for mental health and wellbeing. So if a child's been identified as having possible emotional or behavioural problems, teachers can assist by referring the children and their families to another agency or professional for further review and assistance. So they can do that by, and it's most effective if teachers have knowledge about local support services, if they already have partnerships in place with the parents, the children, and also other agencies in the community, and referring and knowing which agencies to refer children and their families to for appropriate treatment and support. So I think some of the programs that children and families might be able to be referred to would include parenting programs, which can be run by community health centres, family support programs, and also child and youth mental health services. And then if we move on to the last slide as well, D, it's around developing that broader organisational and community strategies that support wellbeing. So as Jo already mentioned, and as I spoke about at the start of my presentation, you really have to think about, what's a whole of school approach to be most effective. So thinking about, having policies and procedures in place about supporting children and teachers' wellbeing, having some sort of service goal or philosophy that supports that, and also having documents and procedures in place, as well as these daily practices that help to role model what that effective pro-social behaviour and looking after wellbeing looks like, as well as that staff orientation and training to key policies. And I think that's particularly important for new teachers to consider. So I think a question that just comes through is around thinking about, how important is teaching resilient skills in preventing suicide in primary school children? And I guess, if you think about the first slide of my presentation, really, that's absolutely crucial. At the primary school age, what we're thinking about for kids is how do we actually help enhance wellbeing? How do we strengthen kids' coping skills and their ability to manage when stressful situations occur, but also how do we pick up early when there's issues that might be going on so we can link people in with the appropriate supports to make sure that things don't escalate, which is what might be happening, say, for example, in the case study with Ronnie. I think I'll leave that there for the moment.
Right. Thanks, Tegan, and I can see you're keeping an eye on the chat and answering some of those questions as well, which is great, helping me along the way. So there's been quite a lot of chat there about programs. So I can see people making some great suggestions around social emotional learning programs, which Tegan did mention. And I guess if you're not sure about Kids Matter, you might not know that there's a programs guide that's there that can be useful for people to find out what programs are there, the theory, the evidence behind them. And I did see someone talked about some good evidence-based programs. So it is important that we're really thinking about some good evidence-based programs. So it is important that we're really thinking about what is evidence-based and what we can trust are going to do what we're asking them to do and what we're looking for. So using our time well. Apps was also something that people were asking about, and again some suggestions have been made, and in the supporting resources document, as you can see, that's there as well. So that was really comprehensive and a lot of information to take in at different levels, which I think is probably the message that people are going to go away with, that you don't just wait until you've got a concern. You're doing all of this day-to-day work, and that's what will actually support students and will prevent suicide, but also mean that you've got some things in place so that you can actually act, and you've got a common language, you've got some policies and processes in place if you are concerned about children. People are asking Tegan about the downloading the poster. So do you want to just talk a little bit about the responsibility resources and people going and having a look at that website? Do you want to just summarise that?
Absolutely. So the child infographic, that's actually downloadable from the responsibility website, as is a fact sheet that goes into a bit more detail explaining the principles behind that. Responsibility is a federally funded program, and it fits in line with the Kids Matter and My Matters programs in terms of looking at the school programs around supporting children's resilience and wellbeing. And this responsibility focuses on the pre-service training for teachers and early childhood workers, or educators, sorry, around how they can support children's resilience and wellbeing. And there's a number of resources, so there's videos and podcasts and a whole lot of fact sheets that you can actually download from our website, Responsibility, and links to that and some of the most pertinent resources are all in the resources document that's been put together by Kids Matter for this webinar.
Great, thanks Tegan. So another really useful resource for people to go and have a bit of a look at. So let's move along, and I'd like to introduce Maria now. Maria Roberto is a consultant psychologist and director of Salutogenics, and Maria's worked extensively for 20 years in the area of educational leadership, trauma response, moved into the management of statewide initiatives around student wellbeing with the Department of Education Early Childhood Development in the Western region in Melbourne. Over to you, Maria.
Oh, thank you, Lyn, and welcome everybody. I'm very excited to be part of the panel. Just a very broad overview that I'm going to do. Both Tegan and Joe have been exceptional in providing an enormous amount of detail. So I guess maybe what I will do is probably provide you with some summary and some dot points at the end. But what I would like to do in the very close work that we do with schools across Victoria and also South Australia, our organisation really specialises in delivering training to school communities, especially school staff and also parents. And what I'd like to offer you is perhaps just some points for us to be thinking about in terms of suicide prevention in young children, which is in itself an interesting concept, given that, and there were some questions that I have seen being asked which are excellent about how can young children really understand the concept of suicide? And I think that's a really good question. And I'd like to start there before going on to my slides. One of the things that we understand when working very closely with young children is that they have feelings, and that these feelings can be when they are in situations where they are being compromised, or they're languishing, or that they are experiencing developmental mental health problems, is that there are an enormous amount of feelings around, huge negative weighted feelings. And they don't really understand that that's connected to suicide. So when we're working with our young people, we know that they are feeling so bad, and we know that they are feeling so helpless. And so they move, and I guess it's almost an emotional or a natural response into demonstrating behaviourally the deterioration that they are experiencing inside. And so we will see self-harming behaviours, or we will even see words and language that young people are using around, oh, there's no point, no one's going to miss me, I don't need to be here, I'm no good to anybody. So the concept of suicide prevention is very much an adult concept rather than a child concept. The child experiences the deterioration, but from an adult perspective, we do see that as suicidal ideation, and we take that incredibly seriously. So they may not have the concept of suicidal ideation, but they certainly do have that internal experience of it. So to go back, bringing this back to the broad perspective that I'd like to talk about, and what Jo and Tegan have done so well, is this notion that any suicide prevention, any suicide response in schools requires a systems response. We work with so many teachers across the board, and they say, what do I do when I have a young child who is indicating that they are in quite a poor space, when I can observe behaviours where they are deteriorating? And what we normally say to teachers is, it's not just your responsibility. Know that there is an entire system behind you, and that the responsibility is of the entire school community, not just one person. And that we can't hold this information because it's not just one person who is responding. Even though it may feel like that there might be one person, like Jo was saying, as the AP, who takes on the majority of the responsibility. But like a child's education, and I've put this in as a dot point because I think it's the most important, wellbeing has the best outcomes when a team of people are supporting, just the way we support their learning, just the way we support their maths and English literacy, any way that you support any learning, wellbeing needs to be the same. And Kids Matter do this brilliantly in their whole school approach. And schools, and know that if you are working in a school, or even if you're part of a school community and you're not staff, but you may be parents, know that schools have a critical incident process. Know that there is a flow chart, like Jo was showing us before, and that Tegan had also referred to. Know what it is for your school, and if you don't know, go and ask. So I think that they are some important learnings that we've taken away whilst working in schools. One of the big areas that we do a lot of work with at Salutogenics is building relational capacity. So what we see is that young people are attachment rich. Young people know where they are safe, they know that inherently. And when we encourage the building of relationships within school communities, we know that the resilience within that school community has a better chance of being protective for those young people. So building relationships in the classroom is absolutely fundamental. And the reason why that is because young children, well as adults, but in particular, they understand relationships based on very small moments. And these are what we talk to teachers about, that it's not just about delivering a resilience program or delivering a whole school program, but students know, they move into this knowing as to what resilience and what good relationships feel like, because they are small moments, things that happen in the classroom, how a teacher is calm, how children are encouraged to speak respectfully, calmly to each other, trust, safety and security. And children are more likely to reach out when the adult around them displays those levels of calmness and feeling and being very centred with the child rather than being reactive. So positive moments are built in relationships, and safe relationships are the child's highest protective factor. And the more we build positive relationships in schools, the more school communities are enabled to act preventatively. So one of the other areas that we tend to focus on in our training is that the second protective factor that we look at is around emotional literacy. And emotional literacy has been something that SEL skills, so social and emotional learning programs, have focused on for a very long time, but I do think we need to be much better at it. And I think we need to be better at it when we are building our relationship capacity, that we don't just teach emotional literacy, but we model it, we demonstrate it. And children can look at that and say, oh, is that what it looks like? Is that what you're talking to me about? So emotional literacy is something that we focus on very, very strongly. And a very new program that Salutogenix is currently working on, and this is very new, is the program with Swinburne University looking at, it's called Aristotle. And a lot of these programs like Kids Matter and Aristotle and You Can Do It, they all share very common themes because the research is very clear about the positive impact of raising emotional literacy. And so this is about naming and expressing our emotions. If we go back to what I was talking about earlier on, when young children are feeling quite vulnerable in the experience of a number of negative emotions that can happen very quickly, the reason why emotional literacy is so powerful is that if young children can put a name to it, they can label it, they can talk about it, they are then less likely to be controlled by that emotion. If children don't talk about it, they remain silent. They will remain silent because one of the things that we see is because they believe that the adults around them are not strong enough to hold what it is that they need to say. Children are so insightful. And the more we can talk about emotions, the negative ones are just as important to be speaking about as the positive ones. It is absolutely critical that they know and that they see what it looks like. What do I look like as an adult when I name an emotion, when I use an emotion, when I use an emotion to negotiate or to be able to include that in a conversation? But it provides children a way to be seen. If I tell you how I'm feeling, you can see me. You don't just see my external, but you know what's happening inside, my heart, my head, my stomach. And it also offers validation. And so this is a huge area. I could go on for ages talking about emotional literacy, but I've got to move to the next slide. And I'm trying to sort of read some questions below, but I'll keep going and maybe read that at the end. What I'd like to do now for the next 3 slides is that I'd like to talk to you about some questions, and these are some tools that we use with our school communities about what do I say. I have so many parents and teachers come to me and say, Maria, when my child at home or when my kids in the classroom, when I see that they may be deteriorating in some way, or that they're disengaged, or that they are looking very vague, and I've been noticing this for a couple of days. What is it that I say? What do I do? The next 3 slides, I've segregated them in approach questions and also questions to expand and summary questions. So, and these are just some questions that I'm offering you as a way to engage young people at the beginning of a conversation. So really basic questions of, so how are you and how are you feeling? How have you been lately? But when we ask these questions, we stop and we pause and we really allow young children to give us a response, whatever that might be. And sometimes they may not be as articulate or as forthcoming. And so we can talk to them about what we've seen, what we've noticed, what we've observed. I've noticed that you've been especially quiet. Is everything okay? Or I've noticed that you've been distant or distracted. Is that right? Or, you know, or can you tell me something else about how you're going? Or I've seen lately that you've been less engaged with your work. Are you okay? I'm concerned about you. Children become quite elated when you say to them, I care about you. Even though as adults we take that for granted, that we just think, oh, well, they know that we care about them, but saying it and articulating it for young children, letting them hear that is important. Now, these are not the only questions to be asking, but I'm trying to give you, I guess, perhaps some options and some sentence starters. When we ask questions as adults, our job is to then remain silent. I'm Italian, I find that really hard to do. But one of the ways that we engage young children is that when we ask a question, we give them time to respond. And I guess that really is part of the way that we connect and then try to further investigate. So this next slide looks at questions to expand. So once the young child has said, oh, look, I'm not feeling too good and I'm not quite sure, I don't know, I'm just feeling down, or I've just been really sad. These are some statements that you might think about saying. I care about you and I care about your learning. I can see that something is distracting or bothering or upsetting you. And then pause, allow the child to respond if they do have a response. To be able to say to a child, I care about you. I care that you seem upset. I'm really happy to listen to see if I can help you in some way. And maybe it's not just me that would be able to offer you some help. And then stop and pause and wait for responses. Show children that you're not ready to just jump in and fix, because as educators and as parents, it's probably the one thing that we want to do because we believe that we're helping. But when we are engaging and building relationships, it really is about allowing that young person to have a voice. I know that saying things out loud can sometimes feel scary. This is a really lovely statement to use with young people. I know that saying things out loud can sometimes feel scary, but I can be a strong listener and I won't judge what you say. Now that statement about I can be a strong listener, so important for young people to hear, because when they are in a really low space, they don't believe that anybody's going to be strong enough. Or sometimes you can say, come and find me anytime during lunch or recess and we can find a quiet place to talk. And another thing is to respect young people's privacy. So don't talk to them in the middle of the playground or in a corridor, but really important just to find a really lovely lit space, fresh, where there's water, a cup of water, drinking, and that there is just easy access to in and out of the room. I care about what's happening for you at this time. Sometimes what you'll find is that children don't want to talk, and we need to respect that. We go, that's okay. But as an adult, don't give up. Don't go, well, I've asked once and I've asked twice. When we think about suicide prevention, how many times is enough time is enough that we should be asking? And I would say, and you don't want to sound like a robot either, but I would be saying that checking in with a young person every couple of days if they are not appearing like they are their normal selves. And like Tegan was saying before, it's about significant impairment to where they were. This last slide is about statements to assist. So we start with inquiry, then we start with expanding. And once you get a little bit of information, we then encourage teams of people to then say, well, what are we going to do now? And these are just perhaps 3 dot points or 3 sentences that we could consider using. Things like, this sounds like it's distressing or upsetting for you. I can hear how hard it is. You're an important student in the school, so we can think about how we can help you. And it's the we approach. It really needs to be, whenever we are thinking about offering a young person assistance, don't say, here's what I think I want to do. This is how we're going to help. That community language back is important, because you cannot hold the one student just on your own. And another dot point is, who have you spoken to about this? Who would you like to talk to about this? Offer the young person options, because sometimes the young person may feel a bit more at ease with somebody else in the school community. Or if you're feeling uncomfortable about what's being said to you, And in schools we talk about just because just because staff and parents are trained in things like youth mental health first aid, and that's huge training that we offer. But if you as an adult do not feel comfortable in holding or having these tricky or sometimes challenging conversations, you don't have to do it. Find somebody who can. So you might say, who would you like to talk to about this? This is something that I'm not good at, but I won't leave you alone with this. We need to think about people who can offer you some strategies. And then the last point is, my job is to make sure that you're okay at this school, and we are here to help you. And I can't help you by keeping this information to myself, but I can help you by making sure that the only people who need to know will know, and that your privacy will be respected, but your priority, but your well-being is our priority. And in that last statement, there is just some information about that if you're getting some really difficult information come to you, like a young person who, you know, is saying that they're feeling really low, that they don't want to be here, or perhaps they've even been self-harming, that information you actually can't keep to yourself. And to be able to say that in a really respectful way so that the child continues to be protected. I could go on and on. My last slide is just a summary of key points that I just like to leave you with. Whenever you are with a young person, act early. Do not wait for a crisis. We know that the earlier that we act, the more likely we are to be able to respond in a preventative and also in a way that does not leave the child alone. Look for signs, make your observations, write them down if you need to, but keep looking and keep looking for those symptoms of deterioration, whether it's behaviour, whether it's emotional, whether they are being highly reactive. Ask how they are. Don't just sit back. Come in and ask. You've got some language now. And when we listen, it's about listening without judgment. It's about stopping and really refraining from what we want to say and just allowing the young person to talk, even though it may be irrational or really hard to listen to. Just allow them to say what they need to say and then help them to connect. I'm going to stop there, otherwise I'll just keep going. And my husband says I can talk underwater, so I'd better stop.
Thanks, Maria. That was a lot of information, and I could see that the chat went really quiet. So I'm thinking people are really taking on board the things that you're saying. And I guess the message is around the importance of relationships, the importance of taking time to have conversations, and particular conversations that people are perhaps thinking about. What does that mean to me in my role? What does it mean to me as a parent? If that's the case, what does it mean to me if I am a teacher or if I'm a psychologist? Or other health professional, what does that mean, and what do I need to be prepared for, and who can help me with that? So there's a lot of information in there, so thank you very much for that. And there are a couple of questions that I think we might come back to, but we do have some questions that we prepared earlier. So Maria, you have a question for Jo that we might move to now. Have you got that handy, or would you like me to read it out? Maybe I'll read it out. So this is for you, Jo.
Yes.
How do you respond to the challenges of setting up a whole school approach to Kids Matter when there might be some resistance to move into this space in schools?
Right, yes, well, I've been confronted with that when we've had schools visit us who are in the infancy of trying to establish Kids Matter in their school, and some of the suggestions that I have given in the past have been around be very careful to ensure that your Kids Matter action team does have at least one member of your school leadership team on it. That may be the principal, assistant principal, leading teacher. It's important that they're represented at that level so that decision making, policy changes and so on can be streamlined by having a person in that leadership position on your action team. I think it's important to then ensure that your staff are able to be on a general Kids Matter team, and that the school does devote the required amount of time to the professional development. When we first started as a pilot school, it was mandated that we dedicated 2 curriculum days so that the whole staff were able to be part of the 4-component training I think to get the whole school approach happening, the journey of all staff going through the professional development together at the same time is essential. I think schools sometimes suffer the, oh, not another program, but Kids Matter isn't a program, it's a framework, and so many things can happen within that framework. The change that can happen in a school is a significant cultural change, where you can go from a school that might be in a combatant environment to a school that is calm, supportive, help-seeking behaviours acknowledged and promoted, and the school move forward together. As we've discussed, knowing the importance of building those relationships, and it's many benefits from that. Students to teacher relationship, teacher to teacher relationship, teacher to family relationships, and it's indisputable that when you're working in that area, the difference it can make to promoting a positive school environment. For schools to, as I said, dedicate the time to the professional development is of utmost importance, because staff need to be trained in recognising early symptoms. It's an area that usually doesn't happen through their teacher training, and to give them the confidence in being able to recognise the symptoms and then knowing what to do as a result of finding out a student may be struggling, and then having those pathways and supports in place. Another thing that you can say to staff who may be resistant is that it is one of the best resource initiatives that I've seen. Accessibility to the resources is there, and it's user-friendly, and you know, just the fact that now staff can sit in the comfort of their own home and view these webinars and get in-depth training that way. And it is one of the answers where health and education are together at a federal level and trying to address the issues that our modern day society has. It's the fact that suicide rates are increasing. There are a lot more risk factors for young children, exposure to addiction, the pressures that come about from social media, the fact that, you know, we're in a society where there's information overload, a materialistic society, climate of uncertainty, young students being exposed to violence either on the media or in the home situation. There are all those reasons that you can give to your teachers as to why schools are a primary source of providing the support needed for promoting healthy minds.
Great, thank you, Jo. That was a fantastic ad for Kids Matter, and I know, you know, this is work you've been doing for 10 years now, so I can hear how it's just embedded in the way that you think and the way that you speak. So it's great to hear that and know that that's the ongoing work that you're doing. So that's fabulous to hear. Jo, you had a question for Maria. Do you have that handy, or do you want me to read it out?
Well, I think Maria actually covered it in the last slide.
Okay, so the question was about...
advance it on with, well, Maria, if you've got the student and the teachers or student wellbeing person is having those conversations and the situation is not improving for the student, when do we take it further, and how do we do that as a practicing psychologist?
Thanks, Jo. Look, from a psychologist's point of view, we would say that you would be taking that conversation further, regardless. If you have been given information by a young person that you can see that they are deteriorating, you can see that there is a significant loss of coping, and that if you can see that the young person really is not being able to come up with resources that are enough for them to be scaffolded with, then certainly those conversations do need to be taken further. And what we would normally say is that parents, given that the parents continue to be protective, because sometimes, you know, there are situations where families are in positions where they can't be protective. But given that we know that, and if we don't, we need to investigate that. But given that we know that, then we would involve the parents as quickly as possible, simply because they are the guardians. They are that child's primary carer, and a GP really should be included into this process. It really does need to be a first port of call. The way that our system is now organised with Medicare and also with all of the research that's coming through Mental Health First Aid Australia is that GPs really do need to be a first port of call, because perhaps we need to have a paediatrician involved, perhaps we need to have speech assessment, neuropsych assessment. You know, we really need to be very thorough and very clear about what might be this child's deficits and what might be the issues that are coming up. And so taking that further, but ensuring the whole time that this young child's information is kept as is that the confidentiality is protected, that we don't just talk about kids that aren't coping well and we bring it into the general staff room and start talking out aloud so that everybody can hear. I think we need to be really, really careful that when young people are not in a good place, that sometimes it can be very easy for stigma to take a hold and for that child to be seen in a particular way. Every child has a right to be better, and every child has a right to improve, and we need to offer those opportunities for young children, offering them counselling, offering them community support, offering the family support. Is important.
Great, thanks Maria. And you can see in lots of ways there's so much more to be talking about, and we could keep going for quite a while, but we need to start wrapping up. But there is a question that's come through that I think it might be good for you to comment on, Tegan, in terms of the work of responsibility. And this is a question around, this is a lot of work for teachers, and teachers going to school and educators in early childhood as well, and having to be thinking about all of this and making sense of it all and knowing how to respond if children are doing this and looking out for signs. And so the question is, you know, do teachers need more training? Should it be integrated? Is their workload already too high? Is it sort of extra? So would you like to just comment on that?
I think that's a tricky question that a lot of people struggle with. I think, yeah, obviously teachers are being asked to do more and more. I think teachers are, however, in a prime position to really be supporting children's development, but also be a key person to help pick up where things aren't going right. I think definitely there should be more education around that, and I suppose that's what responsibility is about, is providing that education for teachers and early childhood educators before they even start working. But even beyond that, I think definitely professional development around these issues is crucial for teachers. But I suppose, and you know, I think it's difficult because it's a really important issue, and it can be hard if teachers are needing to do that in their own time or outside of work. But at the same time, I think teachers are in a position to make such a difference to the lives of the children in their care that it's really important to do so. And I think the other thing too is just to realise that you're not alone. As I mentioned, you know, in terms of suicide prevention, it needs to be a whole of school response. So it's about drawing on the resources that exist within your school, but also other professionals within the community that might be able to assist you with some of the issues you might be dealing with. So it's, you know, important to remember. I think that's something, you know, we all have to remember, regardless of our profession, is that you don't have to deal with this stuff by yourself. It's really important to consult, get further information, and reach out, you know, if you're sort of stuck with an issue.
Great, thank you. Really important points there as well, and it is worth having a look at that responsibility website. We're really getting close to the end, and it does feel like there's still lots of questions that people perhaps have, but hopefully we've answered some questions. Hopefully we're leaving you with some resources to go away and be able to get some more information if you do need that. Or I think that message of who do I talk to? You know, who are the people that can support me with this? Particularly if you do have in mind any particular concerns around children, have a think about who are the people that can help me with this and not feel alone with it. But last sort of comments, I guess, just a quick summary from each of the panellists. Who'd like to go first with just a final comment that you'd like people to take away? Any volunteers? Jo, what about you?
Yes, well, it certainly can make a difference to the culture of a school. The fact that every member of your school community feels supported because you've built those positive relationships, and you continue to sustain the relationships so that you know, they're comfortable to come in and air their concerns with you, and know that there'll be that attentive ear, and also the offer of some advice on where to go next to assist the family in need. The fact that the staff are confident in delivering social and emotional learning skills, and rated as highly as developing numeracy and literacy skills in their students, because it creates a harmonious and productive work climate in the classroom. So the answer to, you know, should teachers take it on? Yes, they should, because the overriding benefits of having students who are mentally healthy is indisputable.
Great. Thanks, Jo. Okay, comments from Tegan maybe next? Just a bit of a wrap-up, takeaway message?
Yeah, sure, Lyn. I suppose I probably just home back to my one key message. That really is the best way for schools to prevent suicide, is that whole of school approach. So if you feel like your school isn't kind of taking that approach at the moment, you can take on board some of the resources that we've talked about and some of the tools we've talked about tonight in terms of implementing them in your own work, but also thinking about what can you do with your colleagues and what can you do as a whole school that will better support the students' resilience and wellbeing.
Great, thank you. And Maria?
I've been sitting here reading all these questions, and I'm trying to, you know, give some sort of responses. Look, I think that the message is really clear. I think act early. I think be available to young people. Know who your contacts are as be available to young people. Know who your contacts are as colleagues. So who in your arena are the wellbeing people, in the counsellors, the chaplains, the APs, you know, who are they? And to touch base and to consistently review policies and flowcharts about, you know, who are the contact people then outside of the school community, and also how do we engage parents. So, you know, again, it's a systemic response, and I think that that's where our perspective needs to come from.
Great, thank you, Maria. And I don't think there's much more I can add in terms of a summary of all of those points, but certainly not being alone with this work, getting support for yourself is really important, and particularly, you know, thinking about how you're feeling at the moment, and if you are needing to, you know, do some things to look after yourself, please do that and take care. And thank you for your participation. Just a quick reminder about Kids Matter, and we felt like we're plugging it all night, but just a little bit more information there if you're not familiar with it. Hopefully now you can see perhaps the importance of having that whole school approach when you are thinking about something as important and perhaps as concerning as suicide prevention, that something like Kids Matter, that whole school approach is really important to the work. So if you haven't done so already, have a look at the website, follow us on Twitter and Facebook, and look at the newsletters and distribute them to others and help that to become part of the conversations and ways of communicating. So I would like to thank you very much for your participation. Thank you very much for the panel with all of that information that we've managed to get through to you. Hopefully that's given people some really good ideas to go away with, knowing where to go if you do need more. The resource information is there, and contacts that you could be making if you do need some more of that. When we do close in a moment, there will be an exit survey before you log out, so it's always helpful for us to get that information from you as to how helpful it can be. And I can see people saying thank you very much, so it does look like people have enjoyed the session. So thank you again, and good evening.